First and also the CEO of Harbor Mortgage Solutions in Braintree, Massachusetts. I've worked with seniors for over 2 decades. The Seniors First radio show was created to help seniors and their loved ones find answers to the many complex questions they have about planning for retirement. Who do you ask? Where do you turn? This Meet the Experts is a Seniors First regular program. This is a monthly program, and we draw from the talent of a collaborative pool of local Eastern Massachusetts senior service professionals. On a monthly basis, we bring you information that helps you improve your retirement. We welcome your comments and suggestions for future shows. Please visit our website at www.seniorsfirstma.com. Today, we are privileged to have Maria Burke, who is the president of Celtic Angels in Weymouth, Massachusetts. This is our second interview with Maria. Today's date, the date of this recording is Wednesday, May 27, 2020, when we are now in the full throes of the COVID-19 pandemic. When I last spoke with Maria on March 3 of 2020, the pandemic had not yet broke. It broke shortly after that. Celtic Angels is a in-home care agency that Maria founded a number of years ago, and it provides in-home care services to seniors throughout Eastern Massachusetts. So, Maria, welcome to Seniors First again, and just if you would, give us a little background on Celtic Angels.
Well, thank you so much, George. It's an honor and a privilege, and you are too kind. And since our last interview, March 3rd, doesn't it feel like the whole world has just stopped and changed? Everybody is, we're Zooming right now. I feel very hip. But anyway, it's been quite a few weeks, and I appreciate you having me, George. So as George said, my name's Maria Burke. And I started Celtic Angels in 2005, and the home healthcare landscape has changed dramatically since I first started my business 15 years ago, and especially in these times with COVID-19, I see there's a shift. People want to be at home. Unfortunately, it's been really sad that the nursing home, they've really done the best that they can do, but it's very hard to stop the spread of virus when you have communities living together, and it's tough on the staffing, because I think that's been a key element of what's happened in our nursing homes and assisted livings. And as well as that, it's been so challenging because there was so much unknown about the COVID-19 virus, and it kind of just hit us all sideways. So I think everybody is coming to terms with our new reality, and staying safe, social distancing. Unfortunately, the saddest part for me personally is the fact that a lot of people have had to pass away by themselves as they are protecting their families. So that has been a very, very sad fact of this virus. In the state of Massachusetts right now, I think we're starting to come out the other side of it, and thank God. Been praying every day, and everything is changing. That's what I have to say about it, George. I think everything is changing in home care.
Well, indeed, everything is changing, Maria, in your world, in our world, in everybody's world today.
Yes.
My description of it is that they didn't shuffle the cards. They've handed us a new deck, and we don't know what the cards are. So it's a whole new ballgame.
A great analogy.
But getting down to seniors and their care in their later years, there have been numerous reports on the issues with nursing homes. And as you mentioned, it is so difficult to manage this pandemic in that environment. And there was an article in the Globe as recently as this morning. It mentioned that the nursing home death rate, the death rate in Massachusetts, 61% of the total deaths are from deaths in nursing homes, and that is almost 4,000 deaths in nursing homes. Now, nursing homes, and they are in a lockdown situation now, where the residents are forbidden now to have guests. They've eliminated their social activities there. And there was also an article that I read in the American Journal of Geriatric Psychiatry that went on and pointed out that there are some pretty severe effects to seniors, both medically and psychologically, from isolation. Everything from increased cardiovascular disease, hypertension, pain, depression, dementia, and unfortunately suicide. So given this bleak reality that we're seeing now, and it'd be interesting to get your comments on how does this contract with the care when people are receiving care in their homes versus the institution? Is there any dramatic difference there? If so, what?
Well, honestly, I think there's a huge dramatic difference. And I would just start with the survival rates. We've actually been taking care of patients COVID-19 positive in their own homes. And thankfully, all of our patients have survived, which I feel is pretty significant. Plus, we've been able to be creative about having family, come and visit. We were luckily enough, we were able to get our hands on the PPE equipment that keeps everybody safe. So, and also I would like to point out that there's no place like home, especially when you're sick. So the advantages from, as you said, George, the mental standpoint, the isolation that people are feeling in the nursing homes, because they really are, they can't see anybody. So I feel there's a huge benefit in the home care setting to our patients who unfortunately enough, contracted the COVID-19. I'm also happy to report that even though a few of our caregivers tested positive, they all weren't hospitalized. They did really well. And, as a home health care agency, this is unprecedented. I don't know how, trying to prepare for a pandemic, I feel everybody is kind of trying to do the best they can. But the Department of Public Health in Boston, Plymouth, Weymouth have been outstanding with trying to help home health care agencies get their hands on the PPE equipment. And we actually now have our own testing site for Celtic Angels caregivers. So before, we had a situation where one of our patients, while we were taking care of her 24/7, tested positive. And so the family notified me straight away, which meant that the caregiver that was on site was at risk. And the whole team, we did the contact tracing. And but thank God, everybody was okay. And we were able to continue to take care of that patient in the home care setting. So our caregivers and nurses are the true heroes. Amazing people. They're taking care of their patients. As I say, we have patients we take care of 24/7. So we're not going to leave them. We're going to take care of them to the best of our ability. So I would say definitely home care has a huge advantage, and I think this is going to change. People aren't going to want to go to the nursing homes anymore in light of what's happened, because really, there is no way out at that point when you're there. you're isolated, confined, and the nursing home staff are doing the best that they can do, but they don't have the staff, unfortunately, to take care of the patients. So.
Well, Maria, I understand the Centers for Medicare and Medicaid is the top regulator for the nursing home industry.
Yes.
And that they are in the process now of rewriting and issuing new guidelines for the nursing homes. And I'm wondering, is there such a regulatory authority supervising the in-home care industry?
Well, right now for the private in-home care, there isn't, George, as shocking as that sounds. When I first started my agency, there was oversight, and you had to go in, you had to, go and be interviewed in the Tip O'Neill building, and, they wanted to make sure that you were qualified to own and run a home health care agency. But now, unfortunately, anybody could start a private duty home health care agency. Being an RN myself has been an absolute huge advantage because I've been able to, come up with the infection control protocols that I want all our Celtic Angels caregivers to follow. Without that medical oversight, I don't know how any home health care agency can function and keep everybody safe, to be truthful.
Well, all of this, of course, is, I'm viewing it from the perspective of somebody that, a family member that may be seeking care for their aging parent or relative. And now there's a lot of questions that they have to deal with,
Yes.
given the challenges that the nursing home community is facing right now. And I think, as you well pointed out, to the best of their ability, people want to remain in their homes. But then there's the question of the quality of the care and the safety. And so this pandemic, as we said at the beginning, has changed everything. Has it changed? Is there any effort afoot to increase training or in some way to bring more control to the quality of care?
That's a fantastic question. And I think it's so important that, all our nurses and caregivers are trained with the COVID-19. We have our own Celtic Angels protocol. And because we can't gather together anymore, we've been using Zoom as our meeting tool.
Mm-hmm.
So every day we have in-services and we review the latest information. We review our new protocols for our client care. We review our protocols for all our caregiver care. And we discuss challenges that the caregivers and the patients are having in their own home. One of the challenges right now is that the N95 respirators, as we've seen on the news, they get very uncomfortable after a while. And we provide 24/7 care for our patients. So we've, been organizing, breaks where they can, take off the respirator, leave the house, go outside, nuances like that makes a huge difference to the patients and to the caregivers. I think for families now looking for care, they have to go through an additional process. So they have to go through a pre-screening process before our nurse will even go out to do an intake. So what they will do is, we have to find out who's living in the house. Is anybody sick? Has anybody traveled abroad lately? Does this patient, who comes to visit this patient on a regular basis? So I think it's very hard for the patient's family because now that all these controls have to be set in place. So that's been, I think, a big change for families, and also for families that like to visit a lot. Now they have to go through our protocol, which means that they have to have a temperature check before they even come into the house. They have to, we have to make sure they haven't traveled out of state, that they're feeling okay, that they haven't been in contact with anybody that's traveled out of state. So it's a lot for patients' families to have to, cope with, on top of taking care of having their mom or dad really needing
Sure.
care. Yeah.
But since this pandemic has erupted, have you noticed an upsurge or a decrease in new client inquiries?
I would have to say an upsurge. We have a lot of clients' families right now, if their mom or dad are in an assisted living even, or a nursing home, they want to bring them home. And they're willing to make alternate arrangements to have them home and, to provide the care at home. I think, a lot of people have been so traumatized because they haven't been able to see their mom or dad or a loved one for maybe 2 or 3 months. And it's I suppose it's like a heartache for them. So they're looking for other ways that they can, have their family member nearer to, that they have more access to them, and they feel that they're safer, they're in a more controlled environment.
And on the supply side in your business, Maria, how about recruiting now? I mean, clearly there's these medical dangers or risks are there for the patients and their families, but there's also at risk for the caregivers,
Correct.
your employees.
Yes.
How has this affected um, your employment ranks, and is recruiting, is that been affected?
Well, actually, we've just turned to Zoom for our recruiting efforts, and right now we're interviewing prospective caregivers and nurses via Zoom.
Hmm.
Now, it's different. I prefer the old way, but it's working. And so our online trainings, everything has gone online right now. So it's just for the safety of everybody. So definitely, I mean, as we said, George, our whole world has been turned upside down and changed. So the way we used to do things, we can't do things like that anymore. So we got to change, which can be very challenging.
Do your services today require more equipment needs to be provided to your aides?
Yes, absolutely. So our aides, they get fit tested for their respirators. They have to, go through a medical questionnaire to make sure that they're medically okay to wear a respirator, which is really important. Um, as I say, thank God, we now have access to rapid testing. If there's any doubt, we send our caregivers, they get tested, we get the results the same day, which is like a miracle. And we were very fortunate. We were able to obtain the hazmat suits, infection control gowns, like so much equipment goes into keeping everybody safe. I would like to give a shout out to Paul Murphy, who converted his advertising equipment, and he made some shields for us. Now, this was in the very early days when we couldn't even get shields. And we were so blessed with, people are so good, George.
Hmm.
Like everybody was rallying around. We couldn't get masks, we couldn't get shields. It was, the PPE pandemonium was like really intense. But we all came together. So we do have a lot of equipment, and we're very grateful to everybody that helped us. If anybody's listening to this webcast, I'm thanking you from the bottom of my heart.
Maria, what type of advice would you give a family now that that may be beginning the search for care for a loved one, where they're looking at a nursing home or in-home care? What
Yeah.
things should they be thinking about?
Yeah. Well, the very first thing and the most important aspect, I feel, is to make sure that the home healthcare agency you're looking at has medical oversight. What do I mean by that? I mean, they should have an RN on staff. The next very important part of this process should be that they have protocols in place. And it's just a simple question to ask. What protocols has your home healthcare agency put in place, to keep my mom or dad safe? And then my next question would be, and how are you keeping your caregivers safe? And from there, I would like to have the family, go on to, are you fully bonded, licensed, insured? Are your caregivers W-2 employees? Very important, as we discussed previously, George. You don't want independent contractors, because then you are liable if anything happens to him in the home care setting. Who creates a care plan for my loved one? Do I get nursing visits? Is there a nurse case manager that's going to oversee the care of my loved one, which is very important? Who supervises the home health aides? Where, are the home health aides, do they get their in-services? Or, is the ongoing education part of your home health care company? I would ask, the nursing staff, are they going to be advocates for my mom and dad if I need them to call the doctor? Who takes care of, like, the medications? Will the nurse come out and review the medications, make sure that everything as it should be? If a caregiver calls out sick, who's going to cover? So any good agency is going to have their on-call care team that are the backup. And they should also have, 24 hours, 7 days a week, answering service, and, always somebody to answer that phone to any question or concern. So that's where I would start. Lots of information.
So there's just so much there. There were just
I know.
many questions today, and so many questions that don't have any answers. But when it comes down to getting care, whether it's institutional care or in-home care, it's a very serious matter for people.
Yes.
I think, there may be listeners that may have further questions about that. Could they call you? Could you give us your contact information?
Absolutely. So as I say, my name is Maria Burke, and I'm an RN with Celtic Angels. Our main office number is 781-331-0062. You're also welcome to go on our website, where we post a lot of helpful information for you if you're looking to pick, choose a home health care agency. Our website is www.celticangelsinc.com.
Great. And my last question for you, Maria, is I know your main office is located in Weymouth.
Correct.
And what is your service area?
We cover the South Shore. We have a second office in Needham that covers the Metro West.
The Metro West.
Yes, yes. But if you're in doubt, please give us a call. If we can't help you, we're happy to refer you to an agency that we've worked with in the past that we could recommend to you.
Well, Maria, thank you very much. These trying times, these are crucial questions for people. And being able to tap into a qualified source such as yourself would be most helpful to people. So this brings us to a close of this month's session, and the Seniors First program is available once a month. You're welcome to give us a call. Again, my name is George Downey. My office number is area code 781-843-5553. Our company is Harbor Mortgage Solutions. We're located in Braintree, and we look forward to hearing from you.